Good morning, everyone, and welcome. I'm Jane Hauser. I'm the Director of Marketing and Outreach for NESCA, and I wanted to thank you for joining us today for the Ask the Expert website, or excuse me, webinar on transition planning and services. Kelley Challen, NESCA's Director of Transition Services, is here to answer all of your questions about IEP transition planning that is related to post-secondary learning, independent living, community engagement, and employment. If you have a question, please type it into the Q&A tab at the bottom of your screen, which has been enabled. And if we aren't able to get to your questions by the end of the session, please feel free to send an email to Kelley or myself, and we'll make sure that those questions are answered. I also just wanted to let you know that we are streaming this on Facebook. So please, as you ask your questions, try not to add any kind of identifying information about your student. With that, we will dive into the Ask the Expert session. Thank you.
Thanks, Jane. So good morning, everyone. I'm Kelley Challen. I'm the Director of Transition Services here at NESCA, and I oversee our post-secondary transition consultation, planning, and assessment services. And I've been at NESCA since 2013, so almost 12 years, but I've been engaged in evaluation, development, and direction of transition-focused programming for teenagers really since 2004. And there's a lot that has come along since 2004, and there's a lot that we're still kind of working on in this area. Just to give you a tiny bit of background on NESCA, we're a group practice with offices in Newton, Plainville, and Hingham, Massachusetts, as well as Londonderry, New Hampshire. And we have clinicians in Burlington, Vermont, and Brooklyn, New York as well. And certainly our transition specialists, we work across the country remotely or in person as appropriate. And then we also provide international services. We specialize in assessment, treatment, and consultation services for children, adolescents, and young adults with special needs, whether mild or complex. And our clinical staff is actually growing right now. So we have almost I think we have 16 neuropsychologists and 5 transition specialists. We have a mix of backgrounds on the transition team in school counseling, occupational therapy, special education, and both rehab counseling. So that's just a little bit about NESCA. I do want to put us all on the same page regarding transition planning and services for students on IEPs. What I want to emphasize is that today we're talking about transition planning and services under the federal law and regulations. And I think this is so powerful to understand and think about that within the Individuals with Disabilities Education Act, the purposes of special education specifically identify the primary purpose of special education is to ensure that all children with disabilities have available to them a free, appropriate public education that emphasizes special education and related services designed to meet their unique needs and prepare them for further education, employment, and independent living. So from the moment a child is on an IEP, part of what that IEP is supposed to do is prepare the student for life when they exit public education. Certainly one of the primary mechanisms by which special education prepares students with disabilities for these post-secondary activities is the provision of transition services, right? So beginning no later than the first IEP that's in effect when a child turns 16 across the United States, although it's 14 in Massachusetts and New Hampshire and some other states, and there's even a state where it starts at 13. So, you know, when children hit these transition ages, when teenagers hit these transition ages, the IEP has to include post-secondary goals. So it needs to explicitly say what the student's going to do when they exit public education. Those goals need to be related to training, education, employment, and where appropriate, independent living skills. And the IEP has to describe the transition services that the student needs, right? So what are the services this student needs to make progress towards their after high school goals this year? That should be documented in the IEP. The goals have to be based on age-appropriate transition assessment. That is not specifically defined in IDEA, but we do have sort of an accepted federal definition that transition assessment is an ongoing process of collecting data on the individual's needs, preferences, and interests as they relate to the demands of current and future working, educational, living, and personal and social environments, right? So we have to have assessment data as a team that was used to define those students' post-secondary goals, and that gives us information about the students' needs, preferences, and interests related to those goals and some of the services that they're going to need this year. In terms of what transition services may include, the law says that IEP transition planning includes consideration of each of the following components for students with disabilities. So it can be academic and non-academic coursework and the specific program of study the student is completing. So whether the student's, what type of end document the student will be getting and sort of how they are progressing along in terms of meeting requirements for that. We need to think about instruction, including specialized instructional needs. We need to think about related services such as therapies, mentoring, job coaching, college coaching. We need to think about community experiences that the student needs to have in order to be able to move forward toward their goals, and things like career and college planning, and if necessary, daily living skills, which means really thinking about whether a student has the self-care, domestic, and community living skills to engage in academic and functional activities now, and then also to progress forward to whatever their post-secondary living goals are in the future. I did just throw one extra slide in here today because just within the last week, the U.S. Department of Education, Office of Special Ed and Rehabilitation Services has released an updated guidance specifically about coordinating transition services and post-secondary access. And so this is really, it's one of the most clear guidances that I've seen in terms of really describing, there's like Q&As on IDEA transition requirements. There's really clear description between how special education transition services and vocational rehabilitation services. So the agencies that specialize in employment, how we can coordinate between special education and our employment organizations. There's information specifically about dual enrollment and post-secondary education in terms of what is appropriate for students who are will be pursuing college in terms of transition services while they're still in high school. And there's guidance in there around pre-employment transition services. And over on the right side of this slide is actually what's on page 8 of this guidance from OSERS. And it's delightful. It says that transition services must consider the student's strengths, preferences, and interests, and may include but are not limited to. But a lot of these things, OSERS is thinking of as potential baseline things that students may need as part of their transition services. And it really gets at some of the life skills students need to pursue their goals after high school, some of the job specific skills they might need, certain community experiences like travel training. And I want to be really clear, not every child on an IEP needs every service on this page by any means. But there is a broad range of activities and skill instruction that can be part of transition services. And IEP teams are really charged with thinking about, in a pretty thorough way, what services the student needs at their current age to be able to progress towards their goals. So I very much appreciate this guidance and some of the specifics in there. And then I just have some resources. Anybody who's attending today, we have your contact information and we'll send out some of these slides. And so I just put some different resources specific to the Mass IEP process in here, specific to just understanding transition planning and services as a whole. And then also specifically around how to find partners to work with as part of the transition planning process, because there are a lot of wonderful organizations on local, state, and federal levels that we can be working with to be able to support transition planning for students on IEPs. I think it's really important to understand that this can't be all on a family and it can't be all in a school. It really needs to be a collaborative process involving community members to be able to successfully transition students. So here's some additional contact information. I do strongly recommend subscribing to NESCA's blog. All of our staff contribute. When I blog, I just basically write about anything that I've been asked multiple times by families. And so I try to write it up so that it's a resource that people can keep in their hands long term. And now let's turn to the questions portion of this. And I'm actually going to pull this down. But if you have questions for us, We want to make sure that you actually put them into the Q&A. So I'm just going to give you a moment, and really any questions you might have related to transition services, transition planning, in Massachusetts or across the United States, please feel free to go ahead and ask those. And I'm going to stop sharing. Here we go.
Okay. My son has intellectual disabilities. He's on track to pass local graduation requirements. Failing MCAS would have guaranteed school services until 22. What are the guidelines now, and how can we make sure that he will continue to get services past his graduation age?
So at this exact moment in time in Massachusetts, we are somewhat living in the Wild West as far as graduation requirements. So just in case anybody's listening from another state, in Massachusetts, we have had high stakes testing called the MCAS that was a requirement for students who were going to have a diploma in the state of Massachusetts. And so the three graduation requirements that existed before December of this year were that students needed to pass that high stakes testing, students needed to meet their local graduation requirements, and students needed to have appropriate transition services. So we no longer have high stakes testing as a criteria, as a state criteria for diplomas. We do not know in many of our school districts what our local school district requirements are to be able to get a state standard diploma for this school year. That is something that school committees and school boards are actively working on right now because they need to decide if they're going to change their criteria. Schools could still utilize that high stakes testing as a criteria. They could still require that, in the town of X, students need to pass MCAS to graduate. There's nothing that precludes a town from doing that, although that's certainly not within the spirit of the fact that we voted, that the state of Massachusetts voted to not have that testing. But so districts are needing to look at their graduation criteria and approve some set of graduation criteria, at least for students who might take a diploma in 2025, but certainly also looking at students who might have exited the district last year, and also looking at other students who are in high school currently who'd been anticipating that as a graduation requirement, and then looking at students who are coming along later. So there's a lot that is just plain up in the air right now as far as graduation criteria. And that makes it really hard if you're attending team meetings in January or February of this year. And we're supposed to be talking meaningfully about whether students are on progress, are progressing with their graduation requirements, but we don't actually have those written out in stone. I think certainly looking to your local requirements previous to December and making sure that everything else is being met, or looking at whether there are things that are not being met. That is one way to think about whether students might be on track to graduate. But the one criteria that is still set in stone, which is really important to be looking at as a parent and as a school team, is whether the students had appropriate transition services. So looking at the current IEP for your student and thinking about, was transition assessment conducted, and is that documented in the IEP? Are the post-secondary goals for the student very clear? Do we explicitly know what the student is expecting to do when they leave their local school district? And then looking for understanding of whether transition services are embedded there. So if a student has a goal of attending college, are there goals and objectives and activities documented within the IEP that are helping the student to progress toward that goal? If a student has a goal of being a welder, are there, activities and goals and services in the IEP that are reasonably setting the student up to achieve that goal? Sometimes there can be confusion, and this is sort of across the United States, in terms of that you can reject a diploma for a student. That's not really what happens. If you have concerns about a student being ready to exit special education during a particular school year, then you're talking about having concerns that their current IEP is not appropriately developed for them. And so what you would need to be doing, again, is looking at that IEP, calling team meetings, perhaps expressing that you don't feel that the graduation date is realistic for the student if it happens to be a documented graduation date of June of this year. And there's reason to think that a student will not have developed appropriate transition skills or had appropriate transition activities by that time. So there's a lot to look at, but right now, the primary criteria that we know a student has to meet to be able to get a diploma in the state of Massachusetts is they have to have had appropriate transition services. And so what's in the IEP right now really matters. And then certainly paying attention and talking with local school elected officials to kind of see what's going on with those graduation requirements is also very important because that's another criteria that we would need to be paying attention to whether students are meeting or not meeting. Um, Next question.
Do you recommend a transition assessment at 14 years old, and how often should this be repeated before a student turns 22?
So that's a great question. I think timing of transition assessment is individualized, just like everything within special education. But the reality is, if a student is in a state where transition services are required to be in the IEP at the time when the student turns 14, then there has to be documentation of some level of transition assessment that happened when the student was 13, right? Because we don't typically write IEPs on a student's 14th birthday. We're usually writing IEPs a little bit ahead of that, and they're going to be in effect when the student turns 14. So transition assessment needed to happen before we write that IEP. Now, there are, something that I do are sort of comprehensive transition assessments that happen in a short period of time. But transition assessment is actually an ongoing process that happens over a prolonged period of time. And so there may be pieces of transition assessment that need to be done for a 13-year-old. I think about, what do we know about that student's career interests or career aptitudes, or what do we know about that student's ability to participate in their IEP process, right? What do we know about their self-determination skills? What do we know about their leisure interests? What do we know about things that would impact choices we might make for that student in late middle school or early high school, right? And so if there are areas of transition planning that we don't have any documented information about as a team, then we have to have a way to get that information when the student's 13, right? If not earlier. So yes, absolutely. I don't just recommend it. Some level of transition assessment is legally required for every student who is, 13 in a state where 14 is when services start, or 15 in a state where 16 is when services start. And so it's very much recommended, but I recommend really different kinds of transition assessment for 13-year-old students than I do for 19-year-old students. The frequency with which transition assessment should be conducted is actually annually. I mean, federal law says that a student's post-secondary goals have to be updated annually based on age-appropriate transition services. However, again, not every student needs comprehensive transition assessment every year, right? We don't need to update cognitive and academic testing for every student every year. We don't need to update career aptitude testing every year for a student. But we certainly might do some targeted questionnaires around transition planning areas, or we might be updating information about the student's career interests. Anything that would affect what their post-secondary goals are is stuff that we want to be updating. In terms of like really, really comprehensive assessments, it just depends when those have happened, when you might next want to have them, right? You certainly want transition assessment information in your team when you're thinking about a student's high school placement, when you're thinking about high school course of study. So you want some detailed information early on in the transition planning process. You certainly also want to have very detailed transition assessment information when we're making decisions around 12, what's going to happen after 12th grade, what's going to happen when the student turns 18. So probably want some really thorough transition assessment toward the end of junior year or early senior year if the team doesn't have that information. But the ideal is that we are doing this in parts and updating the parts that need to be updated as the student goes, and that we have really good progress monitoring for the student, and that we're having open conversations about the student's goals and what the services are that are needed to meet those goals.
Um, Failing MCAS was also a prerequisite for Macy program. Do you expect that to change?
Yeah, actually, it's creating a lot of confusion right now. Um, so Macy program, Macy is just a term in Massachusetts for inclusive college programs. There are inclusive college programs all over the country, but our criteria in Massachusetts, there was sort of a two-prong for inclusive concurrent enrollment in college. One was that if students had not passed the MCAS and were like under the age of 20, so between those 18 and 20 ages, they might be able to participate in this program. There was also a path for students who were still continuing special education but had passed the MCAS to participate a little bit later in Macy. And yes, those guidelines are being looked at. And so we just have to kind of stay tuned for some of that. I would definitely, if there's a particular Macy program that you are invested in a student participating in for fall of 2025, I'd reach out to the individual programs to see if they have a sense of what criteria they might be using. I mean, the good thing is that currently, right, students who are current high school students in 12th grade, they've already taken the MCAS, right? And so students who did fail in 2023 or 2024, like they would still be looked at really similarly for the Macy program right now. Some of that may change as we go forward, and we just have to wait and see how that changes. But I would certainly consider the criteria to sort of be the same for right now and talk directly with individual institutions about whether they're changing anything about their specific criteria while we wait for more guidance from the state.
I have requested pre-employment transition services through Massability as well as through my DDS coordinator. Because my son attends a residential program, I'm being told he cannot participate in pre-ETs. Additionally, DDS is stating that they cannot provide job coaching or exploration due to the fact that he attends a residential program. Have you heard of this happening with other residential students? It's frustrating as if he lived at home and attended a day school program, he would be able to access the support through Massability and DDS.
So just to clarify some things here, because I think that there might be a little bit of just needing to understand which agencies are responsible for what at which points in students' lives. So for a student who is still on an IEP or still participating in education, those students across the United States would be eligible for pre-employment transition services, which is funded by your state's vocational rehabilitation services. So in Massachusetts, that's Massability, but then it is often carried out by a vendor, right? So in Massachusetts, we have different, there's a lot of different vendors that carry out pre-employment transition services. So there's Work Opportunities Unlimited or Best Buddies Careers or a number of different organizations in the Boston area, and so if you're having trouble accessing pre-employment transition services, you can actually look like on the internet, look up Massachusetts pre-employment transition service providers, and you could reach out to any of those pre-employment transition service providers to see if any of them might be willing and able to provide remote services, where they might be able to do some of the pre-employment transition services with a student in the residential setting. You can access pre-ETs through any vendor that's contracted through Massability. It doesn't have to be the vendor that's local to your hometown. You could also be looking at the vendor that's local to the residential school program to see what they offer. Job coaching is a super limited resource, unfortunately. And so there are many students who take part in pre-employment transition services and never end up having sort of ongoing job coaching as part of their experience. A lot of times pre-employment transition services, the sort of final stage that some of the vendors will offer is an internship in the community, but even that may not have like job coaching one-to-one with it. And so you are limited by whatever the contract is, whatever that vendor is sort of offering as far as how they offer their pre-employment transition services. So they're going to have very specific things that they can offer that are being funded by Massability. With Department of Developmental Services, they can offer different employment supports to adults who are no longer part of special education, but they do not typically offer employment supports to children or transition-aged youth, right? While you're still in an IEP, the expectation is that if you need employment supports, that those are going to come through your IEP process, right? So be part of your specialized education program, or that you might get them through those pre-employment transition services that are funded by Voc Rehab. There is no expectation and there is no funding mechanism for the Department of Developmental Services right now to be able to offer more intensive services to students while they're still on IEPs. They're pretty limited in terms of what they can do through child services, through waivers and other things. And then there's a lot more that DDS can offer to a student once they have exited public education and once they're on more of an adult services budget. So just to understand that piece, but certainly there wouldn't be job coaching and there wouldn't be really much of anything for a school age student in terms of employment support through DDS. Mass Ability does have a different program going on right now called the Next Gen program, which is for kids 18 to 26, which offers a little bit more intensive support and a team of workers working with a student, but that is limited to students who are in very specific Mass Ability office areas. So a lot of the offices closer to Boston can access that program. It doesn't matter if you're still in special education or not in public education. If you're between the age of 18 and 26, Next Gen is something that you might look into to see if that would be appropriate, because if your local office or the office local to the residential school happens to be one of the ones that's involved, that might be a possibility. But the truth is that if a student needs employment experience in the community and if a student needs job coaching to access that employment experience, that would typically be a transition service that the team talks about and that is part of what's provided as special education. And that would only be if the team agrees that that's a necessary transition service for that student. So hopefully that sort of explains some of the alphabet soup here in terms of what you can get from voc rehab, what you can get from DDS. I will say something you didn't mention, but it's a really important organization to be aware of, are our independent living centers. There are independent living centers in every state. There are independent living centers across Massachusetts. And if there's an independent living center near that particular residential school program, some independent living centers can offer transition skill building. Sometimes they have a transition to adulthood program or a transition internship program through that independent living center. And there might be somebody there who could provide some job coaching for a student. It's definitely not a guarantee, but it's another resource that we don't think of because they're not like an adult service provider. Independent living centers provide services for individuals with disabilities throughout the lifespan so that they can live and work in their local communities. And so that might be a different agency or resource that the team might be able to incorporate in terms of being able to get some additional employment coaching for students.
My son qualifies for DDS adult services under his intellectual disability at priority 2 level. My understanding is that it is up to us to tell DDS what kinds of supports he needs and that we should build a support program in the $20,000 to $30,000 per year range, which is what a day program would likely cost them if there were enough day spots to go around. How do we figure out what to ask for and what it will cost without having been through it yet?
Transition to adult human services and transition to Department of Developmental Service kind of programming is really complicated for exactly the reasons that you're talking about. It's almost like transition planning in the first place, because what we're trying to figure out for the young adult is sort of what does a meaningful quality of life and weekly schedule look like for that adult. And so you do have to do some creative visioning, ideally with support and somebody who understands the systems, to be able to try to figure out, what are the meaningful activities that you want to make sure are part of your son's daily and weekly life. And then what DDS can be really helpful with is figuring out who are the service providers that are needed to then make those activities happen, and or what other ways can they support that for the young person. But there is this big piece of sort of needing to create that vision, create that daily schedule. I mean, with support from your DDS coordinator or with support from your, they actually have support brokers at DDS, which are different than the support brokers from ARC Massachusetts. But so you really end up working with someone to develop what those activities are going to look like and then trying to figure out how to fund it. And it is true. I mean, sometimes I think, especially as parents, when our kids are moving from really structured 30 or 40-hour a week kinds of programs into the adult human service world, depending on your funding, depending on which organizations have openings, it can be hard because it may not be 30 or 40 hours of structured activities that is going to be funded by Department of Developmental Services. It really depends on, again, what those activities are and who the providers are that you need to be able to support that. If you end up doing more like self-direction, where you end up hiring staff yourself, I mean, how many hours of services you get directly equates to what those staff get paid per hour. And so sometimes you may have more skilled staff for fewer hours per week, or you may have sort of less trained staff for more hours per week. It's not simple math. It's not one particular pathway for any individual. It's person-centered planning. It's transition planning all over again. And the earlier you talk with other parents or talk with providers who can maybe help you plan out those services, the more you can have planned. And then at the same time, Department of Developmental Services, their budget, they're on a budget cycle, a state budget cycle that starts July 1st and runs till June 30th every year. And so depending on when you start with them and how early your referral to adult services was and how much time there is to plan out things, it can be complicated in terms of getting sort of what your child needs at the time that they're entering into that budget. I mean, that's one of the biggest reasons it's so important for, in Massachusetts, we have what's called a 688 referral, which means that school districts make a referral to adult services 2 years before the student exits public education. That's critical because that triggers that the state knows that there's going to be funding needed in DDS services for that student when they exit. And even so, we do a lot of our planning in that last year, that last 6 months before students exit. And so I think as parents, we want to know what's happening 6 months from now, that when you're sort of making that transition, it is a lot of last minute work, right? It's sort of more intensive work as you're getting closer to the student exiting. There is I think it's the ARC of Greater Haverhill actually runs a group for parents who are getting started with self-directed services, learning more about those more individualized services through DDS. So when you're not actually just using an agency or using a particular day program that exists, that's a great group to be able to learn more about how they work and talk with other parents. But there is a lot of, I mean, it's hard work. There's a lot of brainstorming, working with people who know your child well, and you do have to sort of anchor your programming in something specific. So if there are particular activities that you know your child's doing now that they're going to want to keep in their adult life, like thinking that through is really helpful, because the more you know you want as part of that program, the easier it is to then try to fill in other things or think about the staffing for that.
How are transition services impacted by the new Massachusetts IEP format?
So a lot and a little, right? Across the United States, every state's got a different IEP format. In Massachusetts, we just updated our document, which is wonderful because we put in a lot more explicit information about transition planning, about transition services for students. However, like nothing has changed in terms of federal or local laws and guidelines around transition planning and services. We have always been required, well, not always, but since 2004 at least, have been required to put the students' measurable post-secondary goals. What are they going to do for living, learning, and working after they exit public education? That has always been supposed to be in the IEP document. Now it's on the first page for transition age students to indicate what their goals are for after high school, which is important because what we talk about at the meeting is supposed to be what are the services and accommodations and goals the student needs now to progress towards those. So there's space for it in the IEP, which is fantastic. There's a new sort of current performance level specifically around independent living, which is great because as a team, we need to determine if students need to build independent living skills as part of their IEP process. That means somebody has to have done some type of life skills assessment on the student to know if they need life skills or don't need life skills as part of their process. And now there's a direct space in the IEP which asks that question of for current performance levels around that, which is great. And then there's an entire transition section of the IEP that really gets into documenting transition assessment that happened and skills and strengths that the student has that are going to support their goals after high school, and then what needs to be addressed through transition services. And there are check boxes to identify whether you're addressing the transition services through accommodations, through goals, in the additional information section, right? So things that used to be part of a transition planning form and that sometimes were an afterthought are now sort of an active part of this IEP process. I will say the new IEP requires a lot more data to fill it out correctly. So there's a lot more information that teams really need to collect even before the IEP meeting. And that's labor intensive if it hasn't been done before. Again, the law didn't change, but it's a much more transparent document for sort of knowing if we're all on the same page in terms of doing what's legally required for the student. And so there is a lot more legwork that should be happening before IEP meetings to be able to fill out this document appropriately, make sure we have good current performance on the student. It also takes a long time to go through these transition planning sections in a meaningful way for a student. It's why it's so important to start early, right? Like if we've had lengthy discussions in middle school about students' goals and areas of needs and other things, little things might change over time. I mean, even if my vocational goal changes, even if I go from wanting to be, let's say, an opera singer to wanting to be a transition specialist, that's obviously an example from my personal life. There are things that would be really different about what my IEP might need to set me up for, but there would be things that would be quite the same, right? There might be life skills things that would be quite the same, executive functioning things that would be quite the same, social skills things that would be quite the same. There might just be some little differences in terms of electives or career training that would be a little bit different. But so if we start early, if we are thorough with our transition planning, then we can fill out this form really well. And I think the new IEP form and format creates this opportunity for us to really have a meaningful student-centered IEP process, which is what we should have been doing all along, but it was harder to do with the old form. And so there's just a lot more space for discussion and information about transition. And there are also things like notifying the student and parents about transfer of rights, that when students turn 18, the student will be able to have the IEP process be their own, or they can share that or other things, right? There are pieces around places to document other service providers that are involved with the students. So if you are involved with Department of Developmental Services, or if you are involved with vocational rehabilitation, or if there's a pre-employment transition service provider for the student, there's space to now include that and to identify who on the school team is going to be the liaison for some of those outside service providers. So it's just embedded in the IEP now in a way that it was not before, which I think is a really wonderful opportunity for us to then be having this be very much a focus for students.
Great. My son is 16 and his IEP does not have specific transition goals and objectives. He has not taken any transition assessment or career or interest questionnaire. Now, after your answer, I know what to ask them, but in the meantime, I'm having trouble with the district writing transition goals because they do not have information except from what my son has shared. How can I go about the school writing appropriate goals until he's assessed? I wouldn't want to wait until that happens. I've asked to have a PCAST meeting and they said maybe next year. Thank you. And just for clarification, PCAST is person-centered approaches in school and transition.
Yeah. So I think it sort of depends where you are in the country. I know with our new Massachusetts IEP format and with the technical guide, one of the things that is clear and is explicit, but teams are not used to, is that the data that your son has and the data that you have as a parent is relevant data for transition planning for the student. So even just bringing in observations, video data, other things, like you can have some current performance baselines. They don't have to be based on a teacher observing something over a certain amount of time. But that I think it's hard because we may not be used to that in our IEP teams, but it's valid. And there's information in the new IEP technical guide in Massachusetts about that. And there are ways that parent observation is accurate transition data in a lot of different places, although we always like to have 3 data points for anything that we're thinking about doing, right? So that's important data, and we may need a little bit more data. I think it is really hard. I've been in a number of team meetings where we start to, we recognize the student needs a goal in a certain area. But if I didn't conduct the assessment, or if we haven't had, sort of thorough transition assessment recently, we may not have good current performance measures for that student. And so possibly what we're doing is taking some data and reconvening as a team, which isn't exactly how the process is supposed to go, right? But you could potentially start some extended evaluation processes if that needed to happen for a student. You could have objectives that are around taking data on something for the student, right? Like you could talk about having some goals that are based on like student taking data on themselves and being able to report that back to the team, right? There's ways you could think about using objectives to actually build information that's going to be needed for transition planning long term. I realize your son's 16, so we wish we had this stuff sooner, but that's important. And then the other thing is just, I guess I would get the transition assessment done as soon as possible if that's something that needs to be formally requested to start that process, so that you're starting some sort of timeline around assessment. Then make sure that that is put in writing. I mean, honestly, right, like we're all people, and people can make mistakes with things or miss deadlines with things or other things. And so it's just really helpful when it pertains to your own child, if an assessment needs to be done, making sure to put that in writing, even if it was discussed in a team meeting or discussed in a phone call with the district, following up an email, following up with a written letter, just saying like, per our discussion, want to make sure that I'm sort of formally requesting transition assessment be conducted and that it cover, these areas. So hopefully that gives you some ideas for how to get some information into the IEP now. But unfortunately, like without assessment data, it is really difficult to craft an appropriate IEP. And so I want to be making that assessment request as quickly as humanly possible.
So I'm familiar with my child's IEP team. Who should I expect to be on the transition team or on the IEP team during transition ages?
Yeah. So there are some actual requirements within IDEA, right, within the federal law that talk about who needs to be part of an IEP team when transition services and transition planning are discussed. One important piece of it is that students themselves have to be invited to meetings when transition planning services are being discussed. If the student cannot attend the meeting for whatever reason, then the team has to have evidence that the student's voice is being carried into that meeting. And that's where transition assessment is so helpful. We know from research that students participating in their team meetings, being heard in their team meetings, doing goal setting and self-advocacy and talking about strengths and challenges, that is an evidence-based predictor of those students being more successful when they finish public education. So as much as humanly possible, we should be doing whatever's needed, making whatever accommodations needed, doing whatever preparation is needed to really honor the fact that the student is part of the team once we get to these transition planning ages, if not earlier. Another person or people who are supposed to be part of transition meetings, transition discussions for students at these ages would be if there are human service providers, if there are outside agencies who are going to be responsible for delivering any of the transition services, which would include if there are outside agencies that are supposed to be part of transition planning discussions, because there's going to be a handoff between the public education system and the adult human service system. So there can be if pre-employment transition services are happening, then those people should be at the team meetings because they might be carrying out important parts of transition services. If vocational rehabilitation or Department of Developmental Services or a mental health service provider is going to be part of the student's team long-term or carrying out any services, then they should be invited to that meeting and be part of these transition planning discussions. There might be other people on the school team too that change, right? We're sort of, there is a national certification for transition specialists in the United States. Right now, people carrying that credential have been through very specific approved graduate programs to do that. They're working on a process for other individuals to be able to obtain that credential who maybe have been doing transition planning longer term. So There are transition coordinators. Some states also have transition coordinating credentials. Like in Massachusetts, we do have a transition specialist credential here. So you might find that for transition planning discussions, there might be a transition coordinator or a transition specialist or a school to career coordinator or, employment specialist. There might be somebody else who really has a position that's related to transition planning who might be part of those meetings, or there might not. It depends sort of what the responsibilities are of that person in terms of their job description with the actual school district. But there should be people in the meeting who have some relationship with outside service providers, with vocational rehabilitation, with DDS, and can help bring information about that coordination into the meeting. I always think school counselors are critical in meetings. If we're talking about students having met local graduation requirements, the school counselor who's most familiar with those requirements and knows the kid's transcript can be a really important person to be part of the meeting. I think that's particularly important if a student is not in their local school anymore, right? If a student happens to be at a private school or a collaborative school or another school that's out of the district, then sometimes having the school district's school counselor there who is familiar with the local graduation requirements can be really critical to make sure that students are getting sort of equal access and on track with those local requirements. And then it's also like, who's going to make the student feel most comfortable in the meeting? I'm a huge fan of, if a general educator needs to be at the meeting, excuse me, like talking with the student, like, who's your favorite teacher? Like, who makes you feel most comfortable being able to talk and present information in a group? Parents are obviously still part of the team, but there could be other like family, friends, or community members who might also be part of the team. It really depends what's relevant for that student's transition planning.
Are there a lot of transition assessments? If so, what are the specific names? I've agreed to a vocational assessment, and are there other ones that I need to be aware of? I'm in New Jersey.
So yes, I give a presentation specifically about transition assessment. And one of the things that I describe is that, literally, there would be a limitless number of transition assessments because you can use formal, right, sort of standardized published assessments, but you can also use informal transition assessments. So we have a financial literacy assessment at NESCA that started with something that was sort of came from a book, but then we just modified and adapted it significantly to really get at the financial literacy questions that we know to be important for students, right? It's informal. There are a lot of great transition assessments that teachers have created and sort of, on Teachers Pay Teachers website. So specific names of transition assessment, I tend to not suggest requesting from your school district. Specific areas of assessment that you want evaluated thoroughly or specific skills that you want evaluated thoroughly is something you would want to talk about with your team. There is, I'm going to try to share this document, and it's not, it may or may not confuse things more, but I'll try. So this is a document that's called the Transition Assessment Planning Form. Hopefully you guys can see this. And so this was developed by Mary Morningstar and a few of her colleagues. There is a modified version of this for students who have more severe disabilities, but it is a 3-page form that talks about different areas that you might need information about for transition assessment, right? So you mentioned vocation. So I think about like, yeah, do we have information about the student's career interests? Maybe having career interest inventory done. A lot of times you need to do 2 career interest inventories because kids will answer them different depending on time of day and setting they're in. So we sort of always administer 2 at NESCA. You can administer assessments around work motivation or work values, right? If you're going to have a job in adult life, what are the things you value that would be important as part of your job? Is it, do you need to feel important? Do you need to be connected to your colleagues? Do you need to make a lot of money? Do you need to just not get fired? Like job security, you would be amazed how many teenagers job security is a huge work motivator for her for they would rather have a job where they know they're not going to get fired. And that's going to be a value they carry forward for some of those students. Work aptitudes are important. A lot of times if kids have had very thorough cognitive testing and other kinds of stuff, some of that maps on to work aptitude. So I don't always say like you have to have a work aptitude test. But if it's been a while and we don't really know whether students have aptitude for certain jobs, that can be part of it. There can be work readiness, right? There are a lot of different checklists around students' readiness and soft skills for work, pre-vocational skills, assistive technology. That might not be part of a specific transition assessment request, but it's certainly a really important need for people. And so sometimes students need that. Work personality, and then also some of these manual dexterity, mobility kinds of things. Those are going to impact employment and then work environments, right? Do we need that? Does the student need to try out any jobs in particular environments? So I am not at all suggesting that your child needs every one of these areas, but think about the things that feel most important or feel most missing, or talk with your team. Again, conversation is so important. You could sort of say, we're thinking about these areas, like which areas are you actually going to be evaluating, right? And then you'll have a sense of whether something might be missed that's really important. There's another page of this that specifically talks about education and or training kinds of things. So academic achievement testing we often have on students, but does the student know anything about like how they learn best? Do they know anything about accommodations they might need for learning? There are also college readiness assessments. Landmark Guide to College Readiness is a very common one that people have. There are other college readiness checklists. There's a college skills and survival scale. You know, you can do functional observations of students on college campuses if that happens to be, again, what they might be doing post-high school. And then there's all sorts of important independent living skills, self-awareness, self-determination, self-advocacy, some sort of measurement of a student's self-determination skills, how aware they are of their strengths and needs, how aware they are of their disability, how aware they are that they get services and accommodations, how actively they participate in the team meeting process. These things have such a significant impact on a student's success after high school. I would never want a student to have had transition assessment and not have some sort of measure related to self-determination be part of that assessment. And then there's other skills, you know, money management, domestic skills, recreation and leisure skills. Everybody should be able to do leisure as independently as possible, even if it's for a very brief amount of time. So that's something that is definitely an important part of transition. Transportation, travel skills, personal safety, and that may be different at home or in the community or at school. Medical and healthcare skills. If health is complicated for a student, if they're going to rely on a number of healthcare providers in adult life, I want to know about their actual healthcare skills, right? And what the student knows for being able to manage certain discussions on their own, or just manage the transition from pediatric to adult care. Communication is huge, right? Adaptive behavior. And then there's some other social and community skills on here. This isn't even like everything that might be evaluated. I don't even think executive function wasn't necessarily on here, but that's really important, right? But it gives you some idea. And there are other, some of the resources that I shared, like NTACT or has a transition assessment, I don't know, handbook or something you can download. It's like there are lots of handbooks you could download that list off all sorts of different kinds of transition assessment. But again, I think it's much more knowing what are the areas of transition planning that you're most concerned about for your student and that you want to make sure you come out of the evaluation process with data about. So hopefully that is a helpful answer. And I stopped
Okay.
sharing. One more question, Jane, or two more questions? I guess it depends if I'm very long-winded.
Sure. I hope you can hear me. I think my video is frozen. Um, how do you go about doing a transition assessment for a student with Down syndrome and autism who's verbal but who is lower functioning?
Yeah, I actually, I had mentioned NESCA's blog before, and I think I wrote a blog about testing students who tests aren't designed for, sort of, which is a lot of the students we work with, right? I think most kids who are on IEP are not usually standardized kids. But when you're working with a student who, for whatever reason, traditional transition assessment tools aren't made for, you know, a student who has a hard time reflecting accurately about themselves, a student who has a hard time verbalizing what they're thinking in sort of unstructured ways, or a student who's simply going to be dependent on a lot of support in adulthood and may or may not be aware of that. Um, there are assessment tools, and there are more assessment tools being developed that can be really useful for the populations that we're talking about. There are also more curriculum-based kinds of things that are really sort of detail-oriented, like the assessment of functional living skills, or there are other curricula, that just sort of go through skill development in a very detailed way, and more of like a behavioral analysis kind of way. Some of those can be really helpful to administer over time and get baselines of really important functional skills. But there are also tools that are more visually based. There are observation is certainly a really important piece of the assessment. We do a lot of functional assessments. We even have like a coffee making activity that we do in the office to really look at how a student like learns to carry out a life skill task or something like that. So there are a number of different tools you can use. I also think, and I think this for all students, but I especially think this for a student who is going to be harder to just, sit and do a day of testing with. It's really important to make sure you've done thorough record review. It's really important to make sure that you have looked to all the other assessment data that exists on the student. And it's really important to interview and have a good number of questionnaires from people who know the student well, right? If a student has a home service provider, a certain number of hours per week, you better believe I want some information from that home service provider as part of the transition assessment, because there's a lot happening there. If students have, again, like high number of school professionals or private speech therapists, or just a range of people who might have accurate information about who the student is, what their needs are, what might motivate them in post-secondary adult life. We just want to make sure we've incorporated those perspectives into the transition assessment. And so there are a good number of tools that can be used, questionnaires, structured interviews, structured observations, visually based tools, but it's also collecting the data from multiple sources and finding the people who know the student well, who can actively participate in planning. And there are person-centered planning, I want to say curricula, but that's not really what it is, sort of methodologies for working with students that are more visually based and more team based and can be used for students too. And there's charting a life course is a framework that's sort of coming along now. Actually, it's been around for several years now, but I see more people using it as part of this process. So there are a lot of different kinds of tools that can be part of transition assessment for a student who's not a traditional test taker.
Great. My teen is at a residential school. Who should be delivering the transition services? And just to take a step backwards, who should be doing the transition assessment?
Yeah. So at the like very foundation of special education, it's the local school district that writes the IEP, issues the IEP, is responsible for the different aspects of the IEP process being carried out. And so the responsibility always falls on the local school district to make sure that the IEP is comprehensively written, that it has post-secondary goals, that there's transition assessment documented, et cetera. But there are, and also that referrals and invitations happen to human service providers, depending on if that's required in your state and when it's required. At the same time, there are plenty of residential school programs or plenty of private school programs or out of district school programs that do offer the service of being able to conduct assessments for students. And certainly would be the ones to think about, and certainly would be the ones to carry out the transition services that are written in the IEP. So it's tricky because it's the school district's responsibility, but they may or may not monitor, the residential program. They may be expecting the residential program to be doing those things. So I think it's a good question as a parent, who should I be directing these questions to first? And again, it's always going to be the local district that is actually responsible. And then it depends whether they're sort of monitoring that at the residential program and whether the residential program has the resources to carry out transition assessment and services, et cetera. So we are at 12:30. That is all of our questions for today. I'm going to really quickly, if I can, just put actually my first slide back up because that's the one that has my email address. Or if you registered, you probably have Jane's email address. Of course, I'm not like able to do what I said I was going to do for you guys, which is put this slide up. But it is right here, just email address in case you need it. It's just KCHALLEN at nesca-newton.com. And so, please definitely, if there are follow-up questions, feel free to follow up. If you want to schedule any sort of personalized consultation, that's something that we do. We do, just 1 hour consultations with families to kind of work through complicated transition questions. So would love to have anybody come in for one of those if that would be helpful. So thank you so much for your time today. And thanks for your great questions.
Thanks, everyone. Appreciate it. Bye-bye.